Hi, everyone. I'm Sarah Kester. I'm the Interim Director of Global Community Engagement at the Sabin Vaccine Institute. I'm currently leading the BOOST program, which I think you heard a little bit about from Bruce Gellin during today's plenary session. And I see some familiar names from our adaptive leadership session that we just held as well. So thank you, everyone, for joining us today. I know there are a number of different sessions you could be choosing from, so we're glad to have you with us. So today's session is a little bit different from the adaptive leadership session, but focuses on, I think, a really critical issue and a really important project that Sabin recently launched in partnership with Dalberg and JSI called the Vaccine Equity Project. And this, we'll get a little bit more into the details of the project, but today's session is really going to focus on exploring participatory approaches to capacity building. So sharing a little bit about the COVID-19 Vaccine Equity Project, but then also sharing a little bit about how we've been learning from the immunization professional community, and then actually hearing from two immunization professionals, two BOOST members, as well as I think two Scholar alumni and members of the planning committee about their thoughts on capacity building and the COVID-19 vaccine introduction and what types of support are needed. So, there are a number of different folks on the line today, and you'll hear from all of them in due course. But just so you start getting familiar with some of the names and faces here, so myself, and then we have some of our colleagues from Dalberg Design, including Emma, Maria, and Anita, and then my colleague Liz Colway, who I think many of you have heard from as well, working on the BOOST program. So just wanted to orient you to who else on the line, and then of course we have Atahir and Martha from BOOST as well as the Scholar Network. So before I jump into the Vaccine Equity Project, I just wanted to give a very high-level overview of BOOST for those of you for whom this might be new. So BOOST is Sabin's global community of immunization professionals that was really developed in close collaboration with immunization partners and professionals. Our goal is really to be a platform and community that puts immunization professionals at the center of this work. Recognizing that there are a number of different challenges that immunization professionals face, including burnout, including really complex environments, which of course I think we're all facing right now, and then, likely isolation or not able to connect with peers as often as one might like. So these were some of the main challenges that we took into account when designing BOOST. And when we look at BOOST, we have a number of different activities. We have our online platform, we have courses, we have opportunities like this to really share perspectives and experiences. But really our goal with BOOST is to connect immunization professionals to peers, to support and resources to learn and grow, and ultimately lead in challenging situations. So I think Bruce has mentioned a lot of different ways that we do this with BOOST. You heard a little bit about our adaptive leadership work, but today's session will really focus on one of these opportunities for immunization professionals like yourselves to share your perspectives, to really influence program design and influence the way that technical assistance and support is provided. So with that, I will move into a little bit of an introduction around the COVID-19 Vaccine Equity Project. So as I mentioned at the beginning, this is a joint initiative of Sabin, Dalberg, and JSI with startup funding from the Skoll Foundation. We launched back in October of 2020 and have been moving quite rapidly, knowing that this is a really critical time in preparing for COVID-19 distribution. So the COVID-19 Vaccine Equity Project really aims to support ministries of health in low and middle income countries to prepare for and operationalize equitable COVID-19 vaccine programs. So we, together with the group of partners, are technical experts, public health professionals, and implementers who are really initiating this effort in coordination with other global stakeholders, including the ACT-A, the Country Readiness and Delivery Workstream, and then of course, we could not do this work without ministries of health, ministries of finance, other in-country stakeholders, and emergency operations centers. So the tools and learnings from this work are going to be made globally available through a community of practice and through global goods that will be rolling out in the coming months. So I just wanted to speak a little bit about equity. I think we talk a lot about equity and wanted to share a little bit more about how we're thinking about equity in this work. So we've really built a detailed monitoring and evaluation framework around achieving equity outcomes. And what you see on the slide here is a brief overview of our approach. We really believe that equitable outcomes start with equitable processes. And in our experience, the most effective way to do this is by really involving decision makers and stakeholders like yourselves in countries, as well as communities, in the planning, the execution, and the decision-making process. And you'll see just a snapshot of that in today's presentation. Our approach is really substantiated by a survey that we put out through the Boost community at the end of last year. We had an interactive panel and working session that I think many of you may have attended, and then country level engagements and sort of gap analysis and looking at different technical assistance and resources from donors that map to specific equity needs. We really strive to be equitable at every stage of the vaccine distribution process, from representing countries without a voice on the global stage to marginalized communities and individuals in those countries, and really at every stage in between. So I think Liz just shared in the chat a link to the Vaccine Equity Project website. There's plenty of more information and project specifics there. But I think with that, I will turn it over to Male to jump into the meat of today's session.
Thank you so much, and thank you everyone for being here. When we talk about equity, we, as Sarah said, we make sure that we include everyone in the conversation. And how we have been doing it in the past months have been by engaging different stakeholders at different levels to inform our approach and to collaborate into our work. These three groups are the frontline immunization professionals, which we have engaged with via the Boost community platform through different activities. Also the ministers of health of different countries, which we have been in touch with through the pilot countries of these first two stages of the Vaccine Equity Project. I will tell you a little bit more about them in a little bit. And also another way that we have been doing it is with the global and regional potential partners and current partners of our initiative. So making sure that by gathering information and facilitating conversations with these three groups, we can actually understand the challenges and the needs that countries at different levels have in order to prepare and be ready for distributing the COVID-19 vaccine, of course, with an equity lens as well. If we move to the next slide, you can see that at the first level of engaging immunization professionals, we have, and using the Boost community, we have done it in two different ways. One, with the overall community in general, in their community feed, and two, by creating a working group with immunization professionals from different countries, which Atta here and Marta are part of, and having some sessions with them. So far, we have shared different open questions on the Boost platform to gather input and insight. We conducted a survey on country readiness and needs analysis, and also we shared our learnings with the community to gather even more feedback. Also, we had our first webinar hosted last December, where we discussed further on what we have found in the survey, and we had more of an interactive panel with polls, and where people were guiding us and telling us actually what could support these needs and what countries would like to receive. Also, we had some working sessions with our working group to actually refine and get even more specific to the technical assistance that the CEVA project can provide to different countries. On the next slide, you can see on the Ministry of Health level, we have engaged with different countries. Oh, sorry, I skipped one. But all of these, sorry, we can move to the next slide, sorry. All of these activities that we have done have allowed us to actually engage with 107 immunization professionals from different countries, 50 countries across 5 regions, with high representation from the Africa region, but also with different participation from Asia and the Pacific, Europe, Latin America, and the Caribbean, as well as North America. We have engaged with 10 different stakeholders group throughout this time and without a reach, and 47% of them have indicated that are working in the Ministry of Health level, in a national or even subnational level. So it's really the people on the ground and the people doing the on the ground work, the one that are informing the most what the Vaccine Equity Project can provide. Now, on the Ministries of Health level, we have now officially engaged with 4 pilot countries, which are Ecuador, Ethiopia, Kenya, and Nepal. And we have started to define the areas of need for each specific country, as well as the partnership modalities that will benefit them in their planning. We aim in now the phase 3 of this project to expand to 16 countries. That what we have found really interesting is the commonalities and needs and support. For example, some of the countries need support in prioritization, modeling, and planning, meaning identifying who needs to be prioritized, where in which region is this person, and how can we start planning to deliver the right kind of vaccine to this population, right? Other area of support is demand generation and communication packaging. So understanding what are the existing narrative in different communities, myths, and how can we actually contrast that with good communication strategies to get people to get vaccinated. Emma is going to tell you a little bit more in detail actually what the spectrum of the technical support we can provide is. So to you, Emma.
Hello, everyone. So through all of the engagement that Marlene mentioned, we identified 5 big priority areas that were common in many countries, and where our partnership felt that we had specific capabilities to sort of support these countries as they move forward. And so the 5 areas are around immunization team, healthcare worker, and community health worker engagement and training. And that's the one that we're really going to discuss today, given that this is the Teach to Reach conference and it's all about capacity building. The second is around community engagement, mobilization, demand generation, and acceptance. And this being an area that a lot of immunization professionals have pointed out is a big concern. The third is around effective and inclusive planning and coordination, given that this is a vaccine with an entirely different population to what other vaccines are being administered in most of these countries. It's important a very inclusive planning process, and so we aim to support that. Fourthly is around transparent, data-driven approaches to identify, reach, and track vaccine recipients. And so this is really making sure that data is being used to guide who is going to get the vaccine first and next, and why, really. And then the final area is around equitable and data-driven immunization, supply, and cold chain management. And that's really because cold chain and other infrastructure is not always equitably distributed across countries. And so making sure as much as possible that already underserved communities are not being further underserved as a result of infrastructure and cold chain. We are providing technical assistance to support that sort of audit and then also scale up. To the next slide. So focusing on our area that we wanted to talk about today, which is around immunization team health worker and community health worker engagement and training. What a mouthful. Why is this important for equity? Well, amongst the community of immunization professionals, 67% believe that training and supervision was one of the most highly required technical assistance needs to ensure effective vaccine distribution. And so this is really something that is coming out of the community themselves. We know that immunization teams, healthcare workers, and community health workers or community health volunteers will be amongst the first vaccinated, but will also be those vaccinating. And also be champions within the community. And so this is a very important community that we need to make sure are engaged and trained successfully. So on the next slide, countries are currently preparing using the NDVP guidelines for what training and capacity building should look like as they plan for the COVID vaccine rollout. And this falls under 3 key areas, and this is very highly summarized, but the full guide can be shared. And the first area is really identifying the human resources needed. So who are the people that should be involved in this training capacity building? The second is around designing and planning trainings. And so that's really understanding what training is required and what training modalities might be used. And the third is around delivering training and supervision, and so ensuring that the training approach suits the trainee needs, reinforcing this where possible with supported supervision, and employing where possible blended learning approaches. And so this is what most countries are currently using to prepare for the COVID vaccine delivery and for training and capacity building of the human resources that are required to administer and mobilize the vaccine. And so what are we doing as the COVID Vaccine Equity Project? We're hoping to support country efforts in 3 ways. So the first way is doing participatory research to support the adaptation and implementation of training materials. And Francisca, I see that you've noted that the community should be involved in planning. We truly believe that too. And so part of what we want to do is conduct research with immunization professionals, healthcare workers, and community health workers to really understand what are some of the challenges that they're currently facing, and to co-design training modalities that suit them and that are specific to their needs, taking a very bottom-up approach. The second area that we hope to support is by developing a digital peer-to-peer learning network to reinforce learning. And so similar to this amazing community today, how can we leverage the Boost community and other platforms to allow for peers to really share learnings and experiences with each other? And then the third is, how can we support governments by providing linkages to the private sector and to other social enterprises that may support blended learning? And so this is digital learning, it could be other types of training modalities, but how can we provide linkages and capacity to support that? So in addition to what countries are doing, these are the 3 things that the COVID Vaccine Equity Project is aiming to support in each of the countries. All right, to the next slide. I hand over to Anita.
Thanks, Emma. Okay, so before we get into this poll, I'll just do a brief introduction into the survey that we conducted in November last year with the Boost community. Just like my colleagues Sarah and Emma have already mentioned, the COVID-19 Vaccine Equity Project really tried to take a country and community-led approach to first identifying the areas of support needed, either by identifying areas where country representatives were saying, this would be a particularly challenging area, or this area isn't prioritized or currently being addressed, and then putting together our list of offerings. And one of the ways that we did this, like I mentioned, is through a survey that we released through the Boost community in November last year, gaining over 50 responses, a large majority of these being Ministry of Health workers at the national and subnational levels. We also got a wide coverage across geographies, across sectors, and across levels of immunization experience. And so before we show you some of the data that we gathered from doing this exercise, we'd like to hear from you all and do a quick poll. So you'll see on the right of your screen next to the chat function, and the first question of the poll, which is, what do you think you will find the most challenging in order to introduce the vaccine by early or mid-2021? And so just if you look on the right side of your screen, beside the chat function, you can take part in the poll there. Please select up to 3 responses, and we'll give you a minute or two just to think through the question and responses.
So please, and what you need to do is click on polls, which is next to the chat button, if you see above on the right side of your screen, and just click on it, and then you can choose the answer to the question. So we see that some people have already done that. I hope all of you, there are 82 of you in the session, so we are hoping that all of you do the polls.
Great, Anita, should I
Yes, please. I can't see them.
let's see if they appear.
I can see them right.
Great, Molly, so maybe if you could provide, I don't know, Anita, if you can, Molly, are you able to share what the top?
I can voice it over.
Please, thank you.
Number 9, demand generation, community engagement, and communication as the highest rated one with 37%. Then we have the second one, resources and funding, with 21%. And the third one is vaccine distribution, cold chain, and logistics with 14. Closely followed by 1, planning and coordination, as well as prioritization and targeting.
Okay, thanks, Molly. So on the next slide, we'll show you the results that we got when we did a similar exercise through the Boost community. So when we asked immunization professionals, what do you think your countries would find the most challenging in order to introduce the vaccine by early mid-2021, the top response was resources and funding, followed by demand generation and communication, so similar to what you all are saying today. And then planning and coordination was the third highest selection. And so when we asked this, we noticed that prioritization and targeting did not rank very highly at that time, and our team was a little surprised by this. But through further engagement now, we're seeing that a lot of countries are actually requesting support for this, particularly given that this target audience isn't one that respondents are used to, which is infants. And so on the next slide, another question that we asked the Boost community is, what type of global support do you think your country will need in order to ensure a fair approach to introducing a COVID-19 vaccine? And I'm sure you'll all agree with this, but 78% of respondents indicated that their countries will require global support in the form of training and capacity building for technical skills. And that was closely followed by 65% saying that they would require support in terms of capacity building for leadership and management skills. And so we'd like to do one more poll with you all. We shared some of the things that country teams and CVAP hope to do to support learning. We'd like to know from you all, which do you feel are under addressed areas or underutilized areas in your country and would require the most support? So similarly to what you did earlier, please select up to 3 responses from the poll on the right-hand side. And also please use the chat for any questions that you might have.
Great, we'll just give folks a minute or two and then show results. All right. I can't see the results again.
Molly, I don't know if you can see that. Could you share them with us, please?
Can. So the first one, participatory research to assess learner needs and identified competency gaps and requirements, is the first one with 32%. Then followed by budgeting and allocation of adequate human and financial resources to training and capacity building efforts with 27%. And then the third one, we have like almost a tie with providing for the welfare and security of the immunization personnel while training and administering the vaccine with 13%, and support implementing cascade training from national level to regional, provincial level to district, etc., with 11%.
Okay, cool. Thank you so much, Molly, for sharing with us. And thank you all for participating in the polls. We'll keep the results in mind as we refine our offerings further. But with that, just because of time, I'll hand over to Sarah to introduce our next part of the session, which would be learning from the community members. Thank you.
Great. Thanks, Anita. So as I mentioned at the beginning of the call, we are very excited to have two of our Boost community and scholar community members, as well as two members from our Boost working group for the Vaccine Equity Project joining us today. So I'd like to introduce everyone to Atahir Abubakar, who is a technical assistant for the National Primary Healthcare Development Agency, supporting State Routine Immunization Coordinating Center in Zamfara State, Nigeria. And Martha Ngowi, who is a frontline field epidemiologist working at the subnational level with the Ministry of Health in Cameroon. So Atahir and Martha, if you both could turn on video if your bandwidth, of course, allows. We have a few discussion prompts that we would like to ask Atahir and Martha, but of course we would love to hear from others joining the session as well. So please feel free to respond to these in the chat, and if we have time, we will allow a few others to share as well. So maybe I'll start with Martha. Would love to hear from you. What do you think will be the most challenging in order to introduce the vaccine by, let's say, mid-2021?
Thank you, Sarah. Hello, everyone. Nice to meet again on this platform for the Teach to Reach conference. Thank you for the question. I think the first challenge, I'm contextualizing it in Cameroon. The first challenge, I'll have three challenges: community engagement, logistics, and service delivery. Community engagement, we all know about the misinformation around the COVID-19 vaccine that is circulating all around us. And if I may take you back, in December, we had a scenario where we had the National Immunization Day in District X in Cameroon. There was this encounter with one parent in the school with the vaccination team, just because there was not proper community mobilization. So this means if we really have to properly introduce the vaccine, the community must be involved right from the planning. So we need a community to from the planning stage, and then it should also be a multi-sectoral approach where we need the education, health, and also communication. This is to improve the level of trust among the members of the community. The second challenge is that of logistics. We realize that in our EPI targets, we are dealing with 0 to 11 months kids, but now we have extra target, which is not part of the routine immunization for EPI. So we have other people, and therefore we need extra equipment to store this vaccine. And this extra equipment is not the equipment that the cold chain that we have been using every day. The everyday cold chain we have been using at facility district level, they are just +2, +8 refrigerators. But now, depending on the design or the type of model of the vaccine, we need -20 freezer. That we will have to consider those logistics. And also in areas where we have this electricity outage or we don't have electricity at all, to run this -20 freezer will also be a challenge. And also, we take into consideration the third aspect is service delivery. Service delivery, now we are not just dealing with kids where we pay the mothers to bring their kids, but our targets will expand to adults. So it will depend now on the planning. What may apply as a service delivery in a community A or district A may not apply in district A or B or community B. It means we need the community and the table to help us plan which strategy they think it will be best for them for these vaccines to be delivered. And we should also remember the logistics. We will not be able to use our normal vaccine carrier, the +2, +8, depending on the model of the vaccine. If we are to go for outreach, it means outreach might not really work in this case. Thank you. Over.
Great. Thank you, Martha. I think we hear those challenges coming from many immunization professionals across the world. So I think your concerns are shared by others. And I'm just seeing in the chat, it seems a few other folks are indicating planning and coordination will also be a big challenge from their perspective. I'd like to pose the same question over to Atta here. What do you think will be the most challenging in Nigeria to introduce the vaccine in 2021?
Okay, thank you very much. Tyra Obakar, the name as mentioned. My colleague Martha has mentioned some of the challenges which will face similar in my country, Nigeria. Community acceptance of the vaccine is one of the key challenges we are going to face. So the best thing to do for now is community engagement, engaging those community during planning and coordination, involving the stakeholders of the community, vis-a-vis community leaders, local CSOs that are engaged in immunization process should be engaged early so that this communication strategy should be developed to counter what is going on in the society. Currently, there is a rumor that has been filtering into the society that HIV/AIDS has been for more than 3 decades in the country, in the world, globally, but no vaccine has been developed. But COVID that just surfaced just of recent, vaccine have come up. So why the hurry in developing COVID vaccine? So those kind of rumor is going around in the communities. So there is need to counter those kind of rumor, engage the community leaders, develop a good communication strategy, risk communication strategy, so that it will counter. If we have the acceptability of this vaccine at the community level, other things will be easier. Without this, we'll finish the planning, do the coordination, do everything, but if the society or the community refuses, then we are going to fail. So those are the first challenges. Then secondly, our cold chain equipment, our CCEs, are they compatible with the vaccine -20, or are they going to provide an extra CCEs or additional CCEs in designation centers who will have the requirement of the vaccine? So those things have to be checked, because in some of the areas in our country, we are facing challenge of lights, other things that can hamper the storage of those vaccines. Then another challenge that we are emphasizing is under the service delivery, training of our healthcare providers. Do they have the capacity to handle the vaccines? Because it's a different game ball. The previous immunization we are used to has a same target group, 0 to 24 years old. This time around, we are getting something different, a different target group. So there is need to train them on the new vaccine, the strategy, and try to integrate the community, because what will work in community A as their strategy may not work in community B. What will work in state A or county A may not work in county B. So there must be, the generic approach may not resolve this issue. Thank you very much.
Great, thank you, Tahir. And I think your comments are being echoed by many of those in the chat. And as we've talked about quite a bit, I think community engagement is central to this work, right? And the work that we all do. I just want to shout out, hi, Laura. Laura is in the chat from JSI. She's part of the CVET project team as well and is sharing a few resources. So I know we only have a few more minutes, but building Tahir on what you just shared about capacity building and training, and how we equip immunization professionals at all levels of the system to prepare for this. I want to ask, maybe starting with Martha, what type of training or capacity building do you think you would benefit from for this work, but also do you think is really needed for your colleagues, for your peers, in order to effectively roll out the COVID-19 vaccine? Oh, Martha, I think you're muted.
Okay. I think the kind of training that will be needed for all capacity building will be kind of blended training. That is, it should be done remotely and also physically. Even if we are going digital, it does not roll out the physical aspect of training. Of course, we can always go around for the supporting supervision. The training, it can be in 3 phases. Phases where we discuss with actors, maybe frontline workers, even the intermediate and the central level. We take some surveys as to some of the issues that we want to be addressed. And then we move to the second stage of the training, where we have to develop some training materials such as SOPs, job aids, how to organize our vaccination site and vaccine administration and stuff like that. Communications tools also. So after doing all that, this will be based on the results from the survey that we had in the pre-training. And then we go to training proper, where we train both remotely, and then also remotely we can do that on Zoom, and we have seen that during the COVID-19 pandemic in the country, we worked with health workers on Zoom, did some training, introduced some guidelines, all those were done remotely. And then we can also ensure monitoring, also follow up by creating platforms such as WhatsApp, using the ODK, also use Telegram, stuff like that to follow up and also to exchange experience. And once in a while, if we find ourselves on site, we can also do a kind of follow up. That is the kind of training I think that it can be important in this context. Thank you.
Great, thank you, Martha. And Tahir, same question to you. We have just a few minutes, so if you could keep it brief, and then we can wrap up at the end. Thanks.
Thank you very much. The kind of training they need quickly will be vaccine management. How do they administer the vaccine? Then how will they manage AEFI as a result of the vaccine? Then IPC, interpersonal communication, because they are the direct link with the beneficiary of the vaccine. Any challenge, they are the one to face before escalating it out. So if the health workers will be trained on those 3 aspects, then the training can be done using peer learning, face-to-face training. But the key is to manage AEFI, because everybody now is afraid what is going to happen after the vaccine. Because in my country, we have a bad experience of the Pfizer vaccine sometimes back in Kano. So that's some of the matters some people are even bringing now. Even some of the elites are bringing it now. Thank you very much.
Great, thank you, Tahir. So I know we just have about 3 more minutes in the chat. I'm having such a hard time keeping up with all of the really excellent comments and questions. I just want to say, your comments and your input is being recorded. And I think one of the great things about this project is we are actively adapting and adjusting based on the feedback that we're hearing from immunization professionals like you. So you can, if you keep up to date with the Vaccine Equity Project, you're likely to see some of this input reflected in the program design. We are always open to hearing more of these insights from members of the community. Atahir and Martha are two great examples of some of the contributions from the Boost Working Group, but we are all ears. So we encourage you to join Boost. We are always sharing out content from the COVID-19 Vaccine Equity Project, so sharing program updates. Of course, there is the COVID-19 Vaccine Equity Project website, which is vaccineequity.org, where you can also get updates. But also, please feel free to reach out to any of us on the panel here today with thoughts, or if you'd like to share anything else about gaps or trainings that you think would be useful. I think that would be very helpful for our work. The final thing I'll just plug, I see a lot of questions and comments about vaccine hesitancy and misinformation. And just to share that the Boost team is going to be hosting a session tomorrow focused on vaccine misinformation and some skills to combat that. So just wanted to plug that. And with the last minute, I'll just thank our panelists, Atahir and Martha, and thank our colleagues from Dalberg, who did a great job with the presentation and walking us through some of the work that we've done thus far. This is truly a team effort, and we are looking forward to engaging with you all in the future, and of course, keeping you up to date on the progress of this work. So with that, Shalini, I will turn it back over to you. Oh, Shalini, I think you're muted.
Hi, Sarah. Hi, Shalini. Please, Anita. Anita, can you take over from Shalini?
Yeah, can you?
Now we can hear you.
Yeah, we can hear you now.
All right, great. So I was just saying that it's been a fantastic session, and I could see that there are so many participants who are still typing in the chat box, and I have tried to keep all the comments. I mean, I copied all the comments so that the Sabin team and Dalberg team can actually go through them and maybe come up with answers for you. And it's been wonderful having you here, and we hope that you join us tomorrow for the vaccine misinformation session, which Sarah just told you about. So please do check the schedule, and time's up. So see you all and have a wonderful day. I hope you've enjoyed this session, and we'll be there for more.